9 strange signs of prostate cancer. Understand the case of former President Joe Biden. What if your body was sending warning signals right now? Would you know how to recognize the silent symptoms that can indicate prostate cancer? Are you ignoring warnings that could save your life? Men's health is still surrounded by taboos and dangerous silences in our society. Many men prefer to ignore important symptoms out of shame or fear. This attitude can be costly when we talk about diseases such as prostate cancer, a condition that affects millions of men around the world annually. Recent data show that early diagnosis can increase the chances of cure to more than 90%. But how to identify the signs when many of them are subtle or easily confused with other less serious conditions? The case of former President Joe Biden holds valuable lessons about surveillance and preventive care. Would you be mindful enough to identify these signs in your own body? The knowledge we'll share here can literally make the difference between life and death for you or someone you love. Knowing these 9 unconventional signs can be the first step towards early diagnosis and effective treatment. Ready to find out what your body might be trying to tell you? Let's get started. 1. The dangerous silence. Urinary signs that can save your life. Have you ever noticed changes in your urinary flow that you simply ignored? The truth is that changes in the way you urinate can be one of the first warning signs of prostate cancer. Many men believe that these changes are just a normal part of aging. This mistaken belief can delay important diagnoses and compromise treatment. The prostate surrounds the urethra like a ring, and any increase in its size can put pressure on this canal. This pressure often results in weaker or interrupted urinary flow. Studies by the Brazilian Society of Urology indicate that more than 70% of men with prostate cancer have some type of urinary alteration. The need to urinate more frequently, especially during the night, also deserves attention. Getting up more than twice during sleep to go to the bathroom can be a relevant sign. The feeling that the bladder has not emptied completely after urinating is another important indication. The inability to control the onset of urination or to stop urinary flow can be an early sign of prostate problems that many doctors consider critical to diagnosis. Post-urination drip, when a few drops continue to fall even after you have finished urinating, should also not be normalized. Experts from the American Urological Association point out that these symptoms can appear in the early stages of the disease. Postponing the medical appointment in these cases may mean missing the window of opportunity for a less invasive treatment. Remember, these changes do not always mean cancer, but they deserve professional evaluation. Other problems, such as benign prostatic hyperplasia, can cause similar symptoms. Only a urologist will be able to determine the exact cause through specific tests. The PSA, prostate-specific antigen test, and the digital rectal exam continue to be fundamental for the diagnosis. And you, when was the last time you visited a urologist for a preventive checkup? Ignoring these signs won't make the problem go away. On the contrary, it can allow it to quietly worsen. 2. The red alarm. When your body is screaming for help, have you ever found traces of blood in unexpected places and felt that tightness in your chest? The presence of blood in urine or semen is a sign that should never be ignored. Many men are so frightened by this symptom that they prefer to pretend they haven't seen it. This denial can cost precious treatment time when it comes to prostate cancer. Hematuria, the medical term for blood in the urine, can range from a slightly reddish color to visible blood. In some cases, blood may be present in such small amounts that only laboratory tests can detect it. Hematospermia, blood in semen, is less common, but equally important as a warning sign. Data from the National Cancer Institute show that approximately 30% of men with advanced prostate cancer have some of these signs. It is essential to understand that these symptoms are not exclusive to cancer and may indicate other conditions. Urinary tract infections, kidney stones, and inflammation can also cause bleeding. The alarming difference in the case of cancer is the persistence of these signs for prolonged periods, even without pain or other associated symptoms, which often leads to a dangerous delay in seeking medical help. Research carried out by the University of São Paulo reveals that men take an average of 7 months to seek care after noticing blood in their urine. This time can be crucial for the success of treatment in cases of cancer. Early detection can mean the difference between simple treatment and more aggressive interventions. In early stages, prostate cancer can be treated with a higher success rate and fewer side effects. If you notice any trace of blood, even if it appears only once, see a doctor immediately. Remember that the PSA test and other screening tests are essential for men over 50. For those with a family history of the disease, preventive exams should begin at the age of 45. Would you allow your car to keep running with a red warning light on the dashboard? Why do it differently with your own body when it lights up a red alert? 3. The hidden pain. The secret your pelvis may be holding. That persistent pain in the pelvic region that you have attributed to excessive physical exercise? She could be trying to tell you something much more important about her prostate health. Pain in the pelvic area, lower abdomen, lower back, or hip can be subtle signs of prostate cancer. Many men confuse these pains with common muscle or lower back problems. The proximity of the prostate to other organs in the pelvic region explains the irradiation of these pains. When the tumor grows, it can put pressure on nearby nerves and structures, causing discomfort. In more advanced stages, the cancer can spread to the bones of the pelvis and spine. Studies by the Oswaldo Cruz Foundation indicate that 40% of patients with metastatic prostate cancer report pelvic pain. The discomfort can range from mild to severe and is more common during long periods of sitting. Pain that worsens at night or that does not respond to common painkillers deserves special attention. The pattern of pain that gradually intensifies over weeks or months without apparent physical injury is considered by specialists to be an important sign for immediate urological investigation. Men with a family history of prostate cancer should be particularly aware of these pains. The risk of developing the disease increases significantly when a father or siblings have been diagnosed. The Brazilian Society of Oncology records that the risk doubles when a first-degree relative had the disease. It is important to note that not all pelvic pain is related to prostate cancer. Prostatitis, inflammation of the prostate, and other conditions can also cause similar symptoms. Only a thorough medical evaluation can determine the exact cause of the discomfort. Imaging tests such as MR may be necessary for an accurate diagnosis. Have you been paying attention to the messages your body sends through these persistent pains? Or will you continue to ignore a sign that may be trying to save your life? 4. Potency and danger. What your sexual performance is trying to tell you. Erection problems arising for no apparent reason can be more than just stress. Many men don't make the connection between erectile dysfunction and potential prostate problems. This disconnect can lead to late diagnosis of serious conditions like cancer. The prostate plays an important role in male sexual function and seminal fluid production. When a tumor develops, it can interfere with the nerves and blood vessels responsible for erection. Research from the Federal University of Rio de Janeiro shows that up to 65% of men with prostate cancer experience some degree of erectile dysfunction. Changes in the quality of erections, especially when they occur gradually and persistently, should not be ignored. The decrease in sexual desire without apparent cause can also be related to hormonal changes caused by tumors. Reduced ejaculate volume is another sign often associated with prostatic problems. The prostate produces approximately 30% of the seminal fluid, and changes in this gland affect this production. The combination of erectile dysfunction with other urinary symptoms should serve as a red alert that requires immediate medical attention. As highlighted by the main international urological protocols, it is common for men to attribute erection problems to aging or day-to-day stress. This normalization can result in significant delays in detecting more serious problems. Erectile dysfunction medications can temporarily mask the symptom without treating the underlying cause. The use of these drugs without adequate investigation can delay important diagnoses. The Brazilian Association of Urology recommends that men over the age of 40 who develop erectile dysfunction undergo a prostate checkup. Tests such as free and total PSA can provide valuable information about prostate health. Early diagnosis allows for less aggressive treatments and greater preservation of sexual function. Have you sought medical help for erection problems, or simply accepted it as part of aging? This decision can make all the difference to your sexual future and your overall health. 5. Inner fire. When urinating becomes a daily ordeal. Feeling burning when urinating is a sign that your body is sending an urgent alert. Many men immediately associate this symptom with sexually transmitted infections and are reluctant to seek help. This hesitancy can mask serious problems related to the prostate, including cancer. Dysuria, the medical term for burning when urinating, occurs when there is inflammation or irritation in the urethra. When the prostate is compromised by a tumor, it can cause inflammation in the nearby urinary tract. Studies from the Hospital das Clínicas de São Paulo indicate that this symptom appears in approximately 40% of prostate cancer cases. The burning sensation can range from mild to severe and is usually most pronounced at the beginning of urination. In some cases, the burning may be accompanied by a feeling of urgency to urinate. Frequent urination in small amounts can also be associated with this symptom. Men over the age of 50 should be particularly aware of this sign. The persistence of urinary burning for more than 2 weeks, especially when associated with other prostatic symptoms, is considered by experts to be a significant indicator requiring complete urological evaluation. Urinary tract infections, prostatitis, and urethritis can also cause burning, which makes differential diagnosis crucial. Only specific tests can determine the exact cause of the discomfort. Urine testing, culture, and antibiograms are usually the first steps in the investigation. If these tests do not identify infection, prostate investigation becomes necessary. The good news is that, when detected early, prostate cancer has high cure rates. The National Cancer Institute points out that more than 90% of cases diagnosed at an early stage are successfully treated. Regular evaluation of the prostate after the age of 50 is essential for early detection. How much time have you spent ignoring that pesky burning when urinating? Isn't it time to turn discomfort into preventive action? 6. Treacherous weight loss. When losing weight is bad news. Losing weight without dieting or exercising may seem like a gift, but it can hide a dark secret. Unexplained weight loss is one of the most concerning systemic signs associated with advanced prostate cancer. Many men initially celebrate this weight loss without realizing the warning it represents. Under normal conditions, losses of more than 5% of body weight in 6 months without apparent cause deserve investigation. Cancer consumes energy from the body at an accelerated rate, leading to the loss of muscle mass and fat. Research from the University of São Paulo indicates that this symptom is present in about 35% of advanced cases. Metabolic changes caused by the tumor can affect appetite and nutrient absorption. In some cases, the patient maintains a normal diet, but still continues to lose weight. This discrepancy between caloric intake and body weight is an important warning sign. The so-called consumption of the body by cancer can also cause intense fatigue and weakness. The combination of progressive weight loss with other urinary or prostatic symptoms represents a pattern of high oncological concern that requires urgent investigation according to protocols of the Brazilian Society of Oncology. Not all prostate cancers cause weight loss, which is more common in advanced stages of the disease. Therefore, the importance of regular preventive exams for detection in the early stages. Weight loss can also be associated with other cancers or systemic diseases. A thorough medical evaluation is essential to determine the exact cause of this loss. Elevated PSA, prostate-specific antigen, combined with weight loss, significantly increases the suspicion of cancer. Advanced imaging tests such as CT scans may be required for complete evaluation. The good news is that when diagnosed before the weight loss phase, treatment tends to be much more effective. Have you been monitoring unexplained changes in your weight, or simply accept them without question? Sometimes, losing those pounds effortlessly can be the first sign that something very serious is going on. 7. The stolen energy. Why tiredness can be more serious than it seems. That persistent fatigue that even extra coffee can't solve may have a hidden cause. Many men attribute constant tiredness to work stress or old age. They rarely make the connection between this exhaustion and possible prostate problems. Cancer, including prostate cancer, releases substances that can cause chronic fatigue in the body. Inflammatory cytokines produced in response to the tumor directly affect energy levels. Studies by the Oswaldo Cruz Foundation show that more than 60% of patients with advanced prostate cancer report significant fatigue. This fatigue typically does not improve with rest and persists even after nights of adequate sleep. The constant feeling of dragging the body for no apparent reason deserves medical attention. In some cases, anemia can develop as a result of cancer, further intensifying fatigue. Changes in breathing, shortness of breath on small exertion, and pallor can accompany this picture. Oncological fatigue has distinct characteristics that differentiate it from ordinary tiredness. It is disproportionate to the effort made, does not improve significantly with rest, and often worsens throughout the day, unlike the normal energy pattern. When combined with other symptoms such as weight loss or urinary problems, investigation becomes urgent. CBC is often the first test ordered to evaluate causes of chronic fatigue. Testosterone levels can also be checked, as prostate cancer can affect the production of this hormone. Vitamin deficiencies and thyroid problems can also cause fatigue and need to be ruled out. The differential diagnosis is essential to identify the exact cause of the symptom. The good news is that when the tumor is treated, many patients regain their energy levels. Supportive therapies and specific exercise programs can also help combat cancer fatigue. Have you accepted to live constantly exhausted as if it were normal for your age? Or will you start to question if this persistent tiredness is trying to tell you something important? 8. The telltale swelling, the clue that lies at your feet. Have you noticed that your shoes are tighter, or that your socks leave deep marks on your skin? Swelling in the legs and feet may seem like a common circulatory problem, but it can hide something more serious. Many men do not make the connection between lower extremity edema and prostate problems. In advanced stages, prostate cancer can compromise lymph nodes in the pelvic region. This impairment can obstruct lymphatic drainage from the legs, causing fluid accumulation. Research from the Syrian Lebanese hospital indicates that approximately 25% of advanced cases have some degree of edema. Swelling usually starts subtly, being more evident at the end of the day. Over time, it can become persistent and not respond well to leg elevation or other simple measures. In some cases, edema may be accompanied by a feeling of heaviness or discomfort in the legs. The skin in the affected area may appear stretched, shiny, and have difficulty returning to normal when pressed. Unilateral, affecting only one leg, or asymmetric, much more intense on one side, edema is especially worrisome and considered a warning sign that requires immediate medical evaluation to rule out lymphatic obstruction due to tumor growth. The pressure of the tumor on important blood vessels, such as the inferior vena cava, can also contribute to swelling. Advanced imaging tests, such as tomography or magnetic resonance imaging, can identify these obstructions. It is important to note that there are many other causes for leg edema. Heart problems, kidney problems, liver cirrhosis, and varicose veins can also cause similar symptoms. A thorough medical evaluation is critical to determine the exact cause of the swelling. Doppler ultrasound of the lower limbs can help assess blood circulation to the legs. The good news is that, when detected before the lymphatic obstruction phase, cancer has a much more effective treatment. Have you been observing changes in the volume of your legs, or simply buying wider shoes? This attention to detail can make all the difference for an early diagnosis. 9. Silent fragility, when your bones cry out for help. Bone fractures after minor impacts can indicate a problem far beyond osteoporosis. Persistent bone pain, especially in the spine, hip, and ribs, deserves special attention. Many men attribute these pains to aging or excessive physical activity. Prostate cancer has a particular affinity for bone structure when it spreads. Bone metastases are the most common in this type of cancer, mainly affecting the spine and pelvis. Studies from the Federal University of Minas Gerais show that 70% of cases of metastatic prostate cancer affect the bones. When the tumor settles in the bone tissue, it causes destruction of the normal structure and fragility. This embrittlement can result in pathological fractures after minimal trauma or even spontaneously. Cancer-related bone pain tends to worsen overnight and does not respond well to common painkillers. Loss of height due to compression fractures in the vertebrae can also be an indirect sign. The pattern of bone pain that does not improve with rest and progressively worsens over weeks, especially when located in the lumbar spine or pelvis, requires a complete oncological investigation according to international protocols. Bone scintigraphy is a fundamental test to identify bone metastases in patients with suspected cancer. This test can detect changes in bone metabolism even before they appear on conventional radiographs. High levels of calcium in the blood, hypercalcemia, may also suggest bone impairment from cancer. Bone densitometry tests can help differentiate osteoporosis from metastatic lesions. The good news is that there are specific treatments to strengthen bones in cancer patients. Medications such as bisphosphonates and denosumab can reduce bone complications significantly. Radiation therapy is also effective in controlling pain caused by bone metastases. Have you been ignoring those persistent bone pains or decreased height over the years? Sometimes, what seems to be just part of aging can be your body trying to alert you to something more serious. 10. Presidential lessons. What Joe Biden's journey teaches about prevention. The case of former President Joe Biden has brought prostate cancer into the global spotlight. Diagnosed at 2018, Biden underwent treatment while maintaining his public duties. His experience highlights the critical importance of early diagnosis and regular follow-up. Biden had no obvious symptoms when he performed his routine annual exams. It was during a preventive checkup that doctors detected suspicious changes in the PSA test. Later biopsies confirmed a localized adenocarcinoma, the most common type of prostate cancer. The medical team opted for targeted treatment, preserving the quality of life of the then vice president. Biden's case perfectly illustrates how continued surveillance can identify the disease at a treatable stage. The White House later released reports confirming the success of the treatment without relapses. This high-profile case helped demystify the disease and encouraged men to seek preventive screenings. Biden's pragmatic approach to his diagnosis, treating it as a manageable condition rather than a sentence, exemplifies the ideal attitude toward prostate cancer in the age of modern medicine. The decision to publicly share her experience broke important taboos about men's health. Experts estimate that his openness on the subject influenced thousands of men to undergo checkups. This effect, known as the celebrity effect, is powerful in promoting public health. Biden's age at diagnosis, 75, also highlighted how the risk increases significantly after age 70. His case reinforces recommendations that men over the age of 50 should undergo annual checkups. For those with a family history of the disease, exams should start earlier, at age 45. Biden continues to be monitored regularly, demonstrating the importance of post-treatment follow-up. Would you have the same courage and discipline to face your health head-on? Or will he continue to avoid preventive exams that could save his life? The journey we have just taken together is not only informative, but potentially transformative. Knowing these 9 signs can literally make the difference between life and death. But knowledge without action is like a seed that is never planted. It does not produce fruit. This is the time to transform information into concrete action to protect your health. Prostate cancer doesn't have to be a sentence. When caught early, cure rates exceed 90%. True male strength lies in facing fear and seeking help when needed. Now that you know the signs, there's no excuse to ignore or minimize them. Remember that many men were saved simply because they decided to listen to what their body was trying to tell them. Don't be the one who waits until it's too late to act. Make an appointment with a urologist today for a complete checkup. Courage is not in ignoring the signs, but in facing them head-on with determination and wisdom to protect what really matters: your life and time with those you love. If you're over 50, annual PSA and digital rectal exams are essential. If you have a family history of the disease, start these tests at age 45. Share this knowledge with other men in your life: father, brothers, friends. Break the silence and taboos that still surround men's health in our society. Remember that every year of healthy living is a precious gift to you and your loved ones. Early diagnosis is not just about surviving cancer, but about living fully in spite of it. You have the power to choose, ignore the signs, or act preventively. The decision is in your hands, but the consequences will affect everyone who loves you. Choose life, choose prevention. Choose to face fear instead of being controlled by it. Your future will thank you for this wise decision you make today.